new this morning, the ABC 15 Health Insider team tackling an issue worrying health experts. Trust in the COVID-19 vaccine is growing, but is it enough to achieve herd immunity and return to some sense of normalcy? Health experts worry as more doses of the vaccine become available, the challenge will become convincing the people on the fence to actually get it. So what are Arizona doctors doing to put their patients at ease? Millions of shots into the arms of people all across State 48. It's progress, but is it enough? Right now, people here in Arizona are still reporting having a hard time finding these COVID vaccine appointments, but some national health experts worry the problems have just begun. But in a few months, we could be at a point where we have enough supply, but we need to convince some people that they should be getting the vaccine. Does that worry you that there won't be enough people who want the vaccine?
What we're seeing over time is that more and more people are becoming comfortable with the idea of receiving the COVID vaccine. The latest data that I've seen nationally is that about 60% of the population really wants to get vaccinated.
But 60% still falls short of the herd immunity goal in this country, with experts saying we need at least 70 to 75% of the adult population rolling up their sleeves. Dr. Rebecca Sunenshine with the Maricopa County Department of Public Health says soon it'll be about targeting the people who still haven't made up their minds.
And then there's about another 20 to 30% who are kind of on the fence. And as long as healthcare providers are reviewing the safety information and communicating accurate information, I'm confident that those individuals will end up wanting to get the vaccine. There's really just a small percent of the population, about 15%, that is just not wanting to get vaccinated at all. So with that, I think we have a really good chance of getting enough people vaccinated so that we can eventually achieve herd immunity.
But it means health professionals and our leaders will need to work overtime to move the needle on this one. Dr. Sunenshine says there are a number of reasons why a patient may be apprehensive, but she's hoping more minds will change over time. As a medical doctor yourself, what would you say to a patient who was nervous about getting the vaccine? What would you say to convince them that it was a good idea?
First of all, I understand why people are nervous. There's a lot of information out there, and there's a lot of information coming from sources that are often unreliable. So the first thing I say is make sure you find a source you trust. CDC is a great source. The Arizona Department of Health or Maricopa County is a great source. Maybe there's a healthcare system you trust, or a doctor or a nurse. Ask a lot of questions. I would emphasize that what we know about these vaccines is that they are very similar in side effect profiles to other vaccines, that they are incredibly safe.
And we also know the federal government is about to embark on a wide-reaching ad campaign to try and convince more people to get their vaccinations. Dr. Anthony Fauci has also talked about incentivizing the process with promises of a return to a pre-COVID world. Things like going on vacation, attending a concert, even simple things like hugging family members. All of these things, big and small, he hopes will convince more Americans to get the shot. Because if less than 70% of Americans get vaccinated, that could have a drastic impact on how soon we get out of this. If you have a question or a story idea for our ABC 15 Health Insider team, email us at healthinsider@abc15.com. You can also see all of our stories online at abc15.com/health.